Why do TRAb antibodies mimic TSH in Graves' disease? Imagine your immune system gets confused and starts attacking your own body instead of protecting it. In Graves' disease, this confusion leads to the production of special antibodies called thyroid-stimulating hormone receptor antibodies, or TRAbs. These antibodies are designed to target the thyroid gland, but instead of just attacking, they act like they are the hormone that normally controls the thyroid, which is called thyroid-stimulating hormone. The reason TRAbs can mimic TSH is because they are shaped in a way that allows them to bind to the same part of the thyroid cell as TSH does. The thyroid cells have a receptor on their surface called the TSH receptor. When TSH binds to this receptor, it tells the thyroid to produce more hormones. In Graves' disease, TRAbs recognize and attach to this receptor at specific spots called epitopes, which are usually very close to or overlapping with the TSH binding sites. This means they can activate the receptor just like TSH would, but without the normal regulation. Most of these TRAbs are what we call stimulating antibodies. They act as receptor agonists, which means they turn the receptor on. They bind to the extracellular part of the receptor, especially the N-terminal region, causing the receptor to change shape. This shape change triggers internal signals inside the thyroid cells, mainly through a pathway called cyclic AMP. This signaling tells the thyroid to make more hormones and grow larger, leading to the symptoms of hyperthyroidism seen in Graves' disease, like rapid heartbeat, weight loss, and nervousness. There are other types of TRAbs too. Some are blocking antibodies that prevent TSH from binding and stopping hormone production, but these are less common in Graves' disease. Others are neutral and don't affect the receptor. The main cause of the symptoms is the stimulating TRAbs that keep the receptor turned on all the time, causing the thyroid to produce excess hormones. The reason these antibodies can do this is because of their structure. They are a type of immune protein called immunoglobulins. Their binding parts, called Fab fragments, are shaped to fit perfectly into the receptor's ligand-binding domain. This allows them to compete with TSH4 binding, but instead of just blocking it, they activate the receptor. This activation is uncontrolled because the immune system keeps producing these stimulating antibodies, leading to persistent overproduction of thyroid hormones. In summary, TRAb antibodies mimic TSH because they are shaped to bind to the same part of the thyroid receptor as TSH does. By binding to and activating the receptor, they trigger the same internal signals as TSH, but in an uncontrolled way. This causes the thyroid to produce too many hormones, which is the main feature of Graves' disease. Understanding this process helps explain why Graves' disease causes hyperthyroidism and why treatments often focus on controlling these antibodies and their effects. Always remember, if you suspect thyroid issues, consult a healthcare professional for proper testing and personalized advice.